Dance and movement therapy, or DMT, is a unique therapeutic approach that uses movement to enhance emotional, social, cognitive, and physical well-being. It's not about learning dance steps or performing. Rather, it's a professional method where movement serves as a powerful tool for healing and self-expression. You don't need any dance experience to benefit from DMT. The foundation of DMT lies in the understanding that our minds and bodies are closely linked. Our thoughts can influence our posture, our emotions can affect our breathing, and trauma can manifest as muscle tension. By changing how we move, we can also shift our emotions and thoughts. For instance, anxiety might show up as shallow breathing and tight shoulders, while depression could manifest as slumped posture and low energy. At its core, DMT taps into the fundamental truth that movement is our first language. From the moment we are born, we communicate through gestures, facial expressions, and physical rhythms. DMT harnesses this nonverbal communication to promote healing and personal growth. In therapy, movement serves as both assessment and intervention. Therapists carefully observe posture, body tension, gestures, rhythm, energy flow, spatial awareness, breathing patterns, movement speed, eye contact, and personal space. This helps them understand emotional and psychological conditions. For example, a trauma survivor may unconsciously avoid expansion, eye contact, or occupying space. Movement is also actively used for healing. Techniques include grounding, breath work, improvisation, mirroring, symbolic movement, expressive gestures, and rhythm-based exercises. Grounding helps individuals feel stable and present. Improvisation encourages spontaneous emotional expression. Symbolic movement allows for the physical expression of inner emotions, like pushing away imaginary pressure or opening the arms to symbolize acceptance. The roots of healing through movement are ancient and deeply woven into the fabric of tribal cultures and indigenous healing systems. From temple traditions to spiritual ceremonies, movement has long served as a powerful healing force. In the 1940s, modern dance movement therapy emerged in the United States, particularly in psychiatric settings. Clinicians observed that some patients communicated more effectively through movement than through words. Marion Chase, known as the mother of American dance movement therapy, played a pivotal role in this development. Originally a dancer and teacher, she witnessed emotional transformations in her students through movement. Her work with psychiatric patients at St. Elizabeth's Hospital in Washington, D.C., emphasized rhythm, body action, symbolic expression, and the therapeutic relationship. Chase's contributions laid the groundwork for dance movement therapy as a recognized professional field. The American Dance Therapy Association was founded in 1966 to create professional standards, ethics, education pathways, research support, and credentialing for dance movement therapists. Trudy Scoop, a Swiss dancer from 1903 to 1999, made significant contributions by using humor, expressive movement, and improvisation with psychiatric patients, especially those with schizophrenia. She believed that healthy movement could enhance psychological well-being. Mary Whitehouse, who lived from 1911 to 1979, developed authentic movement, a highly influential practice centered on spontaneous inner expression. Influenced by Jungian psychology, her work delved into unconscious emotions and symbolic movement. Blanche Evans, from 1909 to 1982, was a pioneer who merged dance, psychology, and emotional expression. Her work emphasized personality integration and psychodynamic healing. Liliane Espinac, who lived from 1905 to 1988, made significant contributions to movement therapy, focusing on rehabilitation, psychosomatic healing, and emotional recovery. Key terms in dance movement therapy include embodiment, which is the experience of thoughts, memories, and emotions through the body. Nonverbal communication involves conveying messages without words, using posture, gestures, facial expressions, movement quality, and physical distance. Kinesthetic empathy refers to the ability to emotionally understand another person by sensing or resonating with their movement experience. Mirroring is a therapeutic technique where the therapist gently reflects the client's movements, fostering understanding, trust, and emotional connection. Attunement is when a therapist connects emotionally and physically with a client's inner state. Grounding involves practices that help individuals feel stable, safe, and present through body awareness. Improvisation is spontaneous movement that reveals genuine emotions, while symbolic movement uses physical actions to express inner feelings. Body image relates to how someone perceives and experiences their own body on psychological and emotional levels. Movement vocabulary refers to the range of movement a person can express. A limited movement vocabulary may indicate emotional rigidity or trauma, while a broader range suggests flexibility and expression. Dance, Bosch movement therapy is now utilized in various areas, including trauma care, anxiety, depression, autism support, child therapy, elder care, medical rehabilitation, relationship work, psychiatric treatment, and emotional wellness, making it one of the most embodied forms of psychotherapy. Few more terminologies can help us to understand therapy part of this beautiful modality, like body awareness. Body awareness is the conscious ability to notice sensations, posture, breath, muscle tension, alignment, and internal physical states. In dance movement therapy, or DMT, increasing body awareness helps clients understand emotional patterns stored in the body. Somatic awareness refers to the awareness of internal bodily sensations such as heartbeat, tightness, warmth, trembling, numbness, or expansion. Trauma therapy often utilizes somatic awareness because the body remembers experiences that the mind may not fully verbalize. The mind-body connection is the principle that emotional, cognitive, and physical states continuously influence one another. For instance, fear may tighten muscles, sadness may reduce movement, and confidence may expand posture. Body memory refers to the idea that past emotional experiences, trauma, habits, and relational patterns may remain expressed through bodily reactions, even when verbal memory is unclear. Movement observation is the professional assessment of how a person moves. Therapists observe movement quality, rhythm, space use, energy, tension, coordination, initiation, and relational patterns. Movement analysis systematically understands movement behavior to gain psychological insight. Movement patterns are repetitive ways a person moves physically and emotionally, such as always withdrawing, collapsing, freezing, or rushing. Movement quality describes how movement happens rather than what movement happens. For example, a hand lift can be soft, sharp, hesitant, forceful, fluid, fearful, or playful. Expressive movement is movement used intentionally or spontaneously to communicate feelings, thoughts, or inner experiences. Creative expression refers to emotional communication through imaginative physical exploration. Emotional regulation is the ability to manage emotional intensity in a healthy way. DMT helps regulate emotions through breath, rhythm, grounding, and movement structure. Self-regulation is the process of calming or organizing one's internal emotional and physical state independently. Co-regulation is emotional stabilization that occurs through connection with another person, often in therapist-client interactions. Containment means creating emotional safety so difficult feelings can be experienced without becoming overwhelming. Catharsis is emotional release through expression, allowing suppressed grief, anger, fear, or sadness to emerge safely. Projection means unconsciously placing internal feelings onto people, movement images, or symbolic actions. Transference refers to emotional reactions toward the therapist based on earlier relationships, while countertransference involves emotional reactions the therapist experiences in response to the client. Witnessing is observing movement with respectful presence without judgment, especially important in authentic movement. Witness consciousness is the awareness of one's own internal experiences without becoming consumed by them. Authentic movement is a practice developed by Mary Whitehouse, where spontaneous movement emerges from inner impulses while another person witnesses. Active imagination is a Jungian concept influencing DMT, where unconscious material emerges through symbolic expression. Symbolization transforms inner emotions into symbolic forms such as gestures, movement images, or body shapes. The psychodynamic approach in DMT explores unconscious conflicts, childhood patterns, defenses, and relational history through movement. The humanistic approach emphasizes self-growth, creativity, emotional authenticity, and present moment awareness. The behavioral approach focuses on changing observable behaviors through structured movement interventions. Trauma-informed practice prioritizes safety, consent, nervous system awareness, empowerment, and emotional pacing. Dissociation refers to feeling disconnected from body, emotions, memory, or surroundings, and DMT often helps restore embodiment. The freeze response is the nervous system's immobilization response to threat. The fight response involves defensive activation, aggression, or confrontation, while the flight response involves escape behavior or hyperactivity. The fawn response refers to excessive pleasing or compliance for safety. Nervous system regulation helps the autonomic nervous system shift toward balance. The window of tolerance is the emotional zone where a person can process experiences without becoming overwhelmed or shut down. Affect refers to emotional experience or outward emotional expression, while affect attunement means accurately responding to another person's emotional state. The therapeutic alliance is the trusting relationship between therapist and client. Group process refers to emotional and relational dynamics within a therapy group. Interpersonal space is how people physically position themselves in relation to others, and boundary awareness involves understanding physical and emotional personal limits. Spatial awareness means awareness of body position in the environment. Rhythmic synchrony refers to shared rhythm between individuals, fostering connection and trust. Entrainment is biological or emotional synchronization through rhythm. Sensorimotor integration is the coordination between sensation and movement, while motor planning involves organizing movement before action. Impulse is an internal urge initiating movement, and initiation refers to where movement begins in the body. Sequencing describes how movement flows from one body part to another, and integration means bringing emotional, physical, cognitive, and relational experiences into greater wholeness. Laban movement analysis, developed by Rudolf Laban, is a major movement observation framework that studies body, effort, shape, and space. Effort in Laban refers to movement dynamics like strong or light, sudden or sustained, direct or indirect, bound or free. Shape refers to how the body changes form emotionally and spatially, while space pertains to how a person relates physically to their environment. The kinesphere is the personal movement space around the body. The Chase method is a DMT approach inspired by Marion Chase, focusing on rhythm, symbolism, therapeutic relationship, and group connection. The Kestenberg movement profile is a developmental movement assessment framework linking movement patterns with emotional development. This is where DMT transitions into a serious professional discipline rather than simply being therapy with dancing.